1 in 4 of us will develop this common heart rhythm disorder, and the current UK EP market is approximately 90 million. An aspect of care for these patients is offering these patients an ablation procedure. And within the UK, the National Audit of Cardiac Rhythm Management, over the past few years, we've been performing as a nation just under 10,000 cases a year. But we've had COVID, which has exemplified, exacerbated some of the challenges that we faced with these patients. But as a nation, I think it's incredible that we've come together to address some of those challenges, but not only to address them, but to improve on services. We feel here at University Hospital Coventry and Warwickshire that we are improving on services for our patients with atrial fibrillation. I think the 2 pillars in terms of this project, this quality improvement project, is digitalization of healthcare and personalization of healthcare. And with this 2-pronged strategy, these 2 pillars, we've moved forward and worked and partnered with an industry leader with this, because our expertise locally needed support. And with Doccla, we've come together to develop this virtual ward for AF patients. And one of the drivers behind this was the variation and inequality in various aspects of the care that these patients receive. And that ranges from access to heart rhythm specialists, access to advanced therapies such as ablation, and even variations in waiting lists across the country, and what we can do using personalization and digitalization of healthcare to address those variations with the waiting lists. One of the key drivers for this project was the variation in follow-up, and across the region, talking to colleagues, there are huge variations in the way these post-operative patients are followed up. And the whole concept of this virtual ward for AF patients was driven by those key issues. What we've managed to do is to develop this virtual ward where patients are shown how to use various bits of technology. And patients get 3 items. They get a iPhone, a phone, which has got various questionnaires uploaded. And these are really simple questionnaires. Patients on a daily basis can plug in on this app how they are feeling in terms of the various symptoms. And these are validated symptom score tools. As well as this, the AliveCore Cardio device, which has just received in January, it received a nice approval within the UK as a purpose-built diagnostic tool for atrial fibrillation. Patients receive one of these devices, and on a daily basis, or when they have symptoms, they can upload their heart rhythms. And this really is cutting edge in terms of symptom rhythm correlation within the UK. And the final aspect of this virtual ward is patients will have a tracker, and this tracker will track their activity levels. And with this 3-pronged approach of symptom assessment, rhythm assessment, and activity assessment, we'll be able to really tailor the care that these patients need based on those 3 core fundamental problems that atrial fibrillation imparts on patients. Now, with this technology, in terms of the workload for the trust, the systems admin is very low. All the training is performed by Doccla, and this has received considerable attraction by the trust because it is resulting in proactive care rather than reactive care. So by creating a dashboard which our arrhythmia nurse specialists can monitor, they will be able to monitor and see a green light for a patient whose symptoms scoring well, a green light for a patient whose rhythm is showing normal rhythm, and a green light for a patient whose activity trend is satisfactory. And by reviewing this dashboard on a daily basis, we will be able to tailor the follow-up and the healthcare needs for these patients. This is also in keeping with the 24/7 approach that we want to impart on these patients, rather than having in some parts of the country 3 days of monitoring, in other parts of the country 5 days of monitoring, and in other parts of the country there is 7 days of monitoring. And this really will help to address that inequality in the patient follow-up. What we are seeing at the moment is that the information that we have from Doccla is that uptake for these sorts of virtual wards is high. Patient education, patient recruitment is high. And ultimately, this combination of working with healthcare experts with these patients and partnering with an industry leader with this sort of virtual ward technology, we hope will improve the way we are managing these patients.